So here I have all the patients laid out, and I'm going to just show you the reagents that we'll be using for the antibody panel and the antibody screen and grouping typing. So the first thing I want to do is really take off carefully the seal that's on each of these cards. These are the column tube cards that we were talking about in the lecture. These are really important because these have got anti-sera in each of the columns, and you don't want to cross-contaminate each well. So we do that for the grouping. We also do this for the 3-cell screen and also the panel screen. So the panel, we've got 11 cells. Grouping screen, we have only the 3 cells. Next, I want to draw your attention to maybe the booklet, if you have it on hand, just the materials that we're going to be using. So these are the actual panel cells. So you can see they're all labelled 1, 2 and 3. And that kind of corresponds to each of the wells that you've labelled, which is 1, 2 and 3 on the cards. Next is the pipetting technique. So the blood requires to be dispensed on its angle, whereas the serum is vertical. So here I'm just adding the blood on an angle, so it kind of forms a meniscus, an incubation chamber in that cup, so it doesn't go all the way down into the well, just sort of sits in this cup area. So notice I've got the pipette tip on an angle. So I carry on do that for the rest of the panel and the screening cells. The next is to add the serum, so I'm adding this using vertically to all of the tubes. Next, I'm going to make the suspension for the blood group. So it needs to have a suspension, and we're diluting that 50 microliters into 1 ml of diluent to get the right suspension. So again, playing with these factors of having the right amount of antigen to right amount of antibody. So we're diluting the patient's red cells, and we're going to add 10 microliters of this well mixed sample to each of the anti-sera in the blood grouping cards. So on the blood grouping cards, we've got forward and reverse group. So we're adding the red cells to the forward group here, to the anti-A, anti-B, anti-D, and a control. Next, we have reagents, which have cells A and B. We're going to add that to the reverse group. So we're adding A reagent cells, 50 microliters on its side there, so it doesn't go all the way down to the well. And then I'm adding the 50 microliters of plasma. And at this stage, once we've got all our cards done, the screen and panel will go into incubation, and we can go ahead and spin just the grouping cards. They react at room temperature, they're the IgM, and that's pretty much the practical. Thank you.